Thank you, Mr. Speaker. Now, earlier this week, I asked the Minister of Health for an update on Alberta's dementia strategy. But since that time, I've done some homework, and I found that the NDP are falling way short on meeting standards for dementia care and long-term care. The continuing care service standards set the minimum requirements that facilities in the system must comply with. But a recent audit of those facilities and standards found that less than half of the facilities in Alberta meet Standard 9, which deals with training, and 40% fail on Standard 16, which addresses restraint management and secure spaces. To the Minister of Health, is that good enough?
The Honourable Minister of Health and Deputy Premier.
Thank you very much, Mr. Speaker, and I'm so proud to be a part of a government that fought against significant budget cuts that would have had significant impact on all folks in Alberta. And the leader of that party is now the minister, or the leader of that party now formerly was the Minister of Health at the time. Proposing $1 billion cut would have certainly hurt a lot of folks. We've protected and invested in public health care, Mr. Speaker, and we've also expanded the number of long-term care and dementia care spaces throughout the province. There's more to be done, absolutely, Mr. Speaker, but we're not going to do it by slashing billions of dollars from the budget, and we're not going to do it by hurting ordinary folks. I'd be happy to follow up with a member more.
Thank you, Honourable Minister, for a supplemental.
Speaker, I think Albertans deserve an answer to that question. This minister has been Minister of Health for nearly 4 years now and should take some responsibility. Now, I want to dig further into where the system is failing. Standard 11 deals with infection prevention and control. Standard 12 deals with medication management. The report shows that nearly 80% of facilities fail on both measures. 80%. That is absolutely shocking, Mr. Speaker. Again, to the Minister of Health, these facilities house some of Albertans' most vulnerable residents. What are you doing to ensure that long-term care facilities are preventing the spread of infection, managing medication, and meeting the needs of Albertans in long-term care?
Thank you. Honourable Minister.
Thank you very much, Mr. Speaker, and to the member for the important question. Certainly, making sure that we have an adequate supply of long-term care and dementia care spaces throughout the province is a significant pillar in that. That's why we are on track to build 2,000 more spaces by the end of this term alone, Mr. Speaker. We're also working to make sure that we increase staffing and oversight, Mr. Speaker, because we know that there are a number of folks in this province who are in facilities that are long overdue for upgrades and for additional supports, Mr. Speaker. That's why we continue to work with our front lines in AHS, and that's why we won't cut $1 billion from the health budget, because we know that fundamental to this is quality frontline care, Mr. Speaker, that ensures that we care for all folks living in Alberta.
Second supplemental.
This government thinks that is quality frontline care, Mr. Speaker. I'd hate to see what constitutes not quality frontline care. Now, the data that I've been able to find is only summarized in one high-level chart. Now, Albertans living in long-term care, their families and their caregivers, they want to know how the facility that they are living in stacks up against the rest. So what I'm going to ask the Health Minister is, will you table an itemized, specific report of this audit that shows on a facility-by-facility basis which are meeting the standards and which are not?
The Honourable Minister.
Thank you, Mr. Speaker, and to the member for the question. Again, we do have audits of all facilities, Mr. Speaker, on a regular rotation, but we also have special audits if there's a specific concern that's being raised, so that we can bring in additional supports for that, Mr. Speaker. They are posted regularly on the AHS website as well as the HQCA website, Mr. Speaker, and I'd encourage anyone who has questions or concerns about their local facility to talk to the local management, as well as they can raise their concerns with AHS or with myself, Mr. Speaker. We're very proud to be investing, instead of proposing $1 billion cut to health care, like that member's party, or even more by the official opposition, Mr. Speaker.
Wow. Honourable Member for Calgary.